Good morning. My name is Irais Hernandez. I am a community outreach specialist for Parkland Community Health Plan. And we are gearing up again for another one of our Live Learn sessions. Today we have Ms. Samira Abdurazak from Dallas County Health and Human Services, who's going to give us a little brief information regarding tobacco use control and prevention. So I'm gonna go ahead and turn it over to her so she can go ahead and begin this insightful presentation.
Okay, thank you. Hello, my name is Samira again, and I am a health educator here at Dallas County. So we're going to talk about tobacco use control and prevention. So Dallas County is responsible for providing health and social services that protect the health and well-being of Dallas County residents. Our vision incorporates healthy people, healthy communities, healthy and social equity. Our mission is equity and inclusion, accountability, excellence, quality, partnership, collaboration and teamwork, innovation, empowerment, and customer service. So the Chronic Disease Prevention Division, our mission, the mission of the CDPD is to promote and support DCHHS overall missions of protecting the health of the citizens of Dallas County. To this effect, the CDPD thrives to prevent chronic disease and reduce health inequities by addressing environment, systems, and behaviors that are associated with chronic disease and precursors. Guiding principles of CDPD. Our first one is primary prevention. Second is community-based approaches. Third one is partnerships and collaborations. Fourth is evidence-based practices and programs. The fifth one is aim to reduce health disparities and inequities. The sixth one is change health and policy environments. And the last one would be impact assessment and evaluation. So some of our programs for the chronic disease department, we have asthma control, diabetes prevention and management, urban agriculture, what we're talking about today, tobacco use prevention and control, food and nutrition, physical activities, health education and promotion, and hypertension prevention and management. So why is tobacco prevention and control important? So tobacco use control and prevention. So we have intervention and long-term support, leading cause of preventable diseases and death. And we primarily work with people under 18. Okay, so tobacco dependence is a chronic relapsing disorder that, like the other chronic diseases, often requires repeated intervention and long-term support. Tobacco use is the leading cause of preventable diseases, disability, and the death in the United States. Every day in the United States, about 1,600 young people under the age of 18 try their first cigarette, and nearly 200 end up smoking cigarettes daily. In the United States, over $240 billion is spent each year to treat smoking-related diseases. Cigarette smoking harms nearly every organ of the body, causes many diseases, and reduces the health of smokers in general. And all this information is from the 2022 Community Health Needs Assessment. So some of the causes of death in the Dallas County is smoking causes cancers and heart disease, the leading cause of death in Dallas County. In 2020, the number of deaths in Dallas County related to heart disease and cancer continued to outpace the COVID-19 deaths. Smoking is not only the underlying factor for cancer and heart disease, but also aggravating factors for such diseases such as COPD and asthma. So what is tobacco? Now that we've talked about why TUCP is important, let's talk about tobacco. What is tobacco? Traditional tobacco is not always smoked. It can be offered in prayer, burned in a bowl before growing food, and sprinkled on the bed of an ill person for healing, among many other uses. Traditional tobacco is rarely inhaled into the lungs. American Indian and Alaska Native people, and commercial tobacco, health disparities, and ways to advance health equity. So commercial tobacco. To be clear, we are talking about commercial tobacco. Commercial tobacco is defined as the harmful products that are made and sold by tobacco companies. It does not include the sacred or traditional tobacco used by American Indian communities. The use of any tobacco product, including heated tobacco products, is harmful, especially for young adults, and pregnant women, as well as adults who do not currently use tobacco products. So what makes tobacco addictive? So it's the thousands of chemicals contained in tobacco and tobacco smoke that makes tobacco use so deadly. Synthetic nicotine, it's made in a laboratory versus what is naturally found in the tobacco plant. Types of commercial tobacco, combustible, heated, electronic or hookah, and smokeless. And here are some examples of some of the ones that we just mentioned. Anything that is lighted and burned, there are some products that are heated: cigarettes, pipes, mini cigars, biddies, heated tobacco products, etc. Heated tobacco products heat actual tobacco leaf. By contrast, e-cigarettes heat liquids that typically contain nicotine derived from tobacco, as well as flavoring and other ingredients. Since a traditional cigarette is more popular, let's talk about cigarettes. So what is in a cigarette? The most basic component of most cigarettes are tobacco, chemical additives, a filter, and paper wrapping. The tobacco is burned and then the smoke is inhaled. People who smoke are exposed to a toxic mix of over 7,000 chemicals, including more than 70 that can cause cancer when they inhale cigarette smoke. And here are some visuals of electric cigarettes. Electric cigarettes are also considered a tobacco product. E-cigarettes, e-cigs, e-hookahs, vape pens, vapes, tank systems, mods, and electric delivery systems. Hookahs are water pipes that are used to smoke specially made tobacco that comes in different flavors, such as apple, mint, cherry, chocolate, coconut, licorice, cappuccino, and watermelon, amongst others. Although many users think it is less harmful, hookah smoking has many of the same health risks as cigarette smoking. It is not a safer alternative. E-cigarettes and youth. So the National Youth Tobacco Survey in 2022 lists e-cigarettes as most popular among high school students. So we'll spend a few moments talking more specifically about e-cigarettes, what makes them attractive, and discuss some of the ingredients. Many youth are drawn to the flavors: mango, cotton candy, flavored fruit, mint, and many others. So what is an e-cigarette? So e-cigarettes is, So e-cigarettes is just as similar as a regular cigarette. It's just more electronic and has what you call flavor. So things that has acetone, acrolein, diacetyl, and formaldehyde. So what happens when tobacco is burned or heated? Commercial tobacco is defined as the harmful products that are made and sold by tobacco companies. It does not include the sacred or traditional tobacco used by some American Indian communities. So secondhand smoke. This smoke is produced from burning tobacco or heating it. Completely eliminating smoking is the only way to fully protect people who do not smoke from secondhand smoke exposure. Second smoke hand is toxic as well. Cigarette smoke contains more than 7,000 chemicals and compounds. Hundreds are toxic and more than 70 cause cancer. Tobacco smoke itself is known as a human carcinage. Electronic cigarette aerosol / vapor. Again, electronic cigarettes are also considered a tobacco product. They produce a smoke, a vapor, but it's really an aerosol. It's still producing secondhand aerosol. Think aerosol, not water vapor. Think about spray paint, hairspray, or some contents under pressure in a can versus water being boiled in a pot. It's not water vapor. We talked about some of the chemicals in it earlier. So again, those chemical particles are being breathed in and breathed back out by the person, aerolizing or vaping. Third-hand smoke. Another type of smoke people are not familiar with is third-hand smoke. It's a term used to describe the residual contamination from tobacco smoke that lingers in rooms long after smoking stops and remains on our clothes after we leave a smoky place. So some places that they can stay at are carpet and walls, curtains, and furniture, as well as clothing. Smokeless tobacco. Smokeless tobacco is not burned. Chewing tobacco comes in the form of loose leaf, plug, or twist. Dissolvables are finely ground tobacco pressed into shapes such as tablets, sticks, or strips. Snuff is finely ground tobacco that can be dry, moist, or packaged in pouches or packets. And lozenges resembles pellets or tablets. So what happens when smokeless tobacco is used? No smoke byproduct is produced, but it's still harmful to the user. It can lead to nicotine addiction, causes cancers of the mouth, esophagus, and pancreas, and glands that helps with digestion and maintaining. So pancreas is a gland that helps with digestion and maintaining proper blood sugar levels. It's associated with diseases of the mouth as well, and can increase risks for early delivery and stillbirth when used during pregnancy. It can cause nicotine poisoning in children, and also may increase the risk for death from heart disease and stroke. So information about youth and tobacco. So it is illegal to sell to anyone under 21. Quitting smoking lowers your risk for smoking-related diseases and can add years to your life. Youth use of tobacco products in any form is unsafe. Preventing tobacco product use among youth is critical to reducing tobacco use among the nation's youth. Tobacco products use is started and established primarily during adolescence. Nearly 9 out of 10 adults who smoke cigarettes daily first try smoking by the age of 18. Flavoring in tobacco products can make them more appealing to youth. In 2021, about a little over 80% of high school students and a little over 74% of middle school students who used tobacco products in the past 30 days reported using a flavored tobacco product during the time. In 2023, a little over 90% of high school students and 87% of middle school students who use e-cigarettes in the past 30 days reported using a flavored e-cigarette during that time. So this is just a warning. The use of any tobacco product, including heated tobacco products, is harmful, especially for youth, young adults, and pregnant women, as well as adults who do not currently use tobacco products. So why quit? It's never too late, too quick. There are benefits at any age, such as decreases risk for cancer, decreased risk for cardiovascular disease, and lowers risk for lung disease as well. And also reproductive benefits. And here is just a little video that you also could view via YouTube. It's called Benefits of Cessation Over Time by the CDC. So DCHHS Tobacco Use Control and Prevention Program. So some of the things that we've created is tobacco-free campus policies, education presentations, and tobacco cessation. We work with churches, workplaces, colleges, institutions, apartment complexes to help create a healthy environment. We can also help them create or update any no smoking or no tobacco use policies for their institution. That covers not only inside the building, but also in the outside property. We can provide education presentations such as this one to faith-based groups, workplaces, health fairs, etc. If you need help quitting, please call us. We can provide a variety of resources that we hope will meet your needs. There are several programs available depending on your schedule. We are connected to Parkland and connect you with their programs as well. And this is just the FDA thing that says quitting is a process. So if you know someone you know is trying to quit, the FDA has an encouraging poster. Quitting is a process. Every time you try to quit, you get closer to quitting for good. Keep going. And this is our contact information, our main line, our website, and also our email. And here are some of the sources that we provide. And that will be it for the presentation today. Thank you for listening.
Thank you, Samira, so much for your presentation this morning. I appreciate it. I hadn't unmuted myself there, so I do appreciate you taking the time this morning to give us this presentation. It was a wealth of information regarding the control and prevention in regards to tobacco use for our, a way for us to prolong the lives of not just ourselves, but our youth. So I do appreciate that. I do want to remind everybody that's in our session that you can find this video as well as the videos of our sessions that we've had in the previous times that we've had our to learn sessions on our YouTube channel. You just have to search Parkland Community Health Plan, and it will give you a list of all the previous topics that we've had. I also want to remind you that if you're not following us on Facebook, you can search Parkland Community Health Plan. Go ahead and give us a like and a follow. We do post information regarding any events that we may do in the community, as well as any educational outreach that we will be doing as well. So thank you again, Samira, for your time today. I do appreciate that. And this concludes our session for today.
Thank you so much. Thank you for having me.
No, thank you.